Hello, everyone. This is Annalyn Schooley, president of the Florida Family Therapy Alliance. Welcome to our November 2025 workshop. I am thrilled to be introducing an old friend, though he doesn't look like an old friend. He looks like a very young old friend, my Paul Maione. He was ahead of me in the doc program at Nova Southeastern and kind of dragged me through some things to make sure I got finished. And I was just telling him earlier, he's one of the few clinicians that I look up to and admire as better than me. So I'm thrilled that he was willing to give us some time this evening. He is a couples therapy expert, but has been working hard at developing would you call it a style, a orientation, a
Well,
philosophy,
the,
something
the
of
common language is
doing
model,
work.
so yeah.
Yeah. So this is a way of doing therapy that I believe you're now calling transformational inquiry.
Yes.
That's right. Right. So Paul Maione, everyone.
All right. Thank you very much, Alan. Appreciate it. Great to be here. So before I begin, I want to share a couple of stories that have helped shape who I am as a clinician. The first one took place at my Uncle Jack's funeral. Aunt Grace and Uncle Jack were married for like 60 some odd years. And at the funeral, Aunt Grace recounted to me how one after another people would come up to her and say, "I'm sorry for your loss. At least he's not suffering anymore. He's in a better place." And she said if she had to hear one more platitude, she was going to tear her hair out. She said the most meaningful moment happened when someone she barely knew, an acquaintance, came up to her and just stood next to her and held her hand and said nothing. She said it was such a wave of relief to not have to respond to a platitude or even feel any of the emotions of the platitudes. The well-intentioned, obviously, good intentioned platitudes. The next example happened when I was growing up. We had a next door neighbor named Carmine, and I was about maybe 11 or 12 years old. Carmine used to make his own wine in his garage, and he used to enlist us kids in the neighborhood to help him de-stem the grapes. And it was a long and tedious process. And one day I went over to the Carmine's garage and he was in there de-stemming the grapes. And I was ranting about something, I don't even remember what it was, but something my parents had said or done, or probably my brother had upset me about something. And I just went over and started complaining and ranting to Carmine, and he pretty much ignored me. So I ranted and raved a little bit more, and he ignored me a little bit more. And he finally just pushed a bowl in front of me and pointed at the stool. And I sat down and I started de-stemming grapes as I had many times before. We didn't say anything for a good 15 or 20 minutes. But before I knew it, we were talking and we were laughing, and I couldn't even remember what I was upset about. The third story occurred about 10 years later. I'm about 19 years old in community college in my first psychology class, Psych 101. And I was fortunate enough to have a professor who was also a therapist. And he would come in and share stories of his clients. And one day he came in and he shared the story of a middle-aged man he was seeing probably about 10 or 12 times. He felt very stuck with the case. He was bored. He kind of dreaded the sessions. He didn't really feel like he was being very helpful. And on a whim, he said to the guy, "Hey, it's a nice day out. It was a nice northeast fall day. Why don't we go have the session outside?" Behind the building where he practiced, there was a small pond with some park benches. And he would sit on the park bench on his lunch hour and occasionally feed the ducks. So he made the suggestion to this client. And he said, sure. So they spent the session sitting on the bench, saying very little, and they sat and they just fed the ducks. He said the therapy was never the same after that. He said the guy went on to make all sorts of changes, of which I don't recall. He said the therapy was very different. He never felt bored with the sessions anymore, and the guy participated in ways that he had never done before. And he said one common theme for every session afterward was the guy would always make mention at some point of that day that we fed the ducks. What do these stories have in common? A funeral, destemming grapes, and feeding ducks.
Presence.
Exactly. Presence, not necessarily talking about a problem, not necessarily trying to get anywhere. In each instance, there was some level of suffering, and that suffering exactly was met with presence. Okay, I'm going to share my screen now, and I'm going to be talking about, like Dr. Schooley said, transformational inquiry, present-centered ideas about how to approach the work that we do as therapists. That's who I am. I've formed these ideas over about 30 years of practicing, supervising, teaching, and writing about therapy. My name is Paul, and I'm a therapy nerd. So I want to talk a little bit about the distinction between the job of a therapist and the calling to be a therapist. I'm going to give you a framework for evaluating models of therapy, talk about some of the assumptions of transformational inquiry, and then hopefully give you some practical ideas that you can bring to your session about connection and recentering therapy into the present moment. So let me start out by drawing the distinction. I find this helpful in training new therapists to distinguish between the job of what we have to do as therapists and the calling. The job is important. The job gets us paid. The job helps us get licensed. But the job is also administration, it's billing, it's speaking in languages and discourses that oftentimes marginalize our clients. The language of reimbursement and DSM pathology is what gets us paid, but it certainly doesn't contribute necessarily to healing suffering that we encounter. So again, it's not like the job isn't important, but there are certain aspects of the job that we do because they help us to participate and play nice in the world of mental health. And so we have to answer the question, can we do the job? But we also have to answer the question, can we answer the calling? And for most of us, we got into this work for other reasons, not necessarily to become better pathologists or to participate in discourses that marginalize clients, but to help be part of a process where we can relieve suffering, where we can put our skills like listening and empathizing into practice, where we can be alongside of people in their pain and suffering, resisting the urge to want to change them and having the courage to sit with people in their pain and suffering. So it's a very different question. Can we answer the calling? For me, the calling is what keeps me doing this work. It's much more affirming. It is those activities that keep me coming back. And if I just had to do the job, I don't think I would be in this field any longer. So let's take a moment. Can anybody speak to this distinction and where you are with it at this point, how it's maybe evolved from when you were training to where you are now in your practice?
Hey, Paul, how you doing?
Good.
Yeah. I for many years, as I got my PhD, marriage family therapy, probably before you. But then I was teaching at seminary and practiced for 20 something years in the Archdiocese in Louisville and taught pastoral care.
Mm-hmm.
And so courses on listening and being present. And so when I see this, I would have loved to have had this distinction. I never made it this way, but using this kind of language. But when I look at the calling, that's what I tend to call pastoral counseling. It's pastoral care. It's just how to kind of be with people in really hard spaces and not flinch and truly be present and believe in them and believe that they can come out the other side. And so I actually appreciate the distinction that you make in the job and then the calling. So I just want to thank you.
Yeah, sure thing. I try to bring this distinction to new therapists who are training because they oftentimes get disillusioned with the job aspects of their internship. And so, I want them to see that there's another aspect to this work. And if you want to nurture that other aspect, you have to kind of be active about it, surrounding yourself either with people or readings or both, communities that nurture the calling. It's funny you use the phrase, Thomas, being with people, because that's the title of the book I'm writing, Being with People. Anybody else?
Well, as a brand new, freshly graduated student, I took a gap year, and I wasn't sure if I was going to go through the licensing process, but I felt the calling. I don't have to do it for money. I'm 67, almost 68, and but I want to do it because my daughter has said, Mom, you are such a good therapist, because she's a marriage and family therapy master's degree person also. My mother had a master's degree in psychology. And the several of the clients that I had in my internship, just gave compliments to me of how I helped them, that helped me realize that it's a calling for me. So, yeah, and I want to save this slide because it will help remind me of why I am going to go through the licensing process, because it is a calling.
Fantastic. I'm happy to share the slides with folks. If Annalyn has a way of collecting emails or something, I'm happy to share them with her, and then she can share them with the group.
Yep, I can do that. I can definitely do that. Meredith, I know you had your hand up.
I did. In a former life, Paul, I was a hospital chaplain and also trained as a pastoral counselor. Still see myself that way as one of my primary identities, in addition to marriage and family and sex therapy. And people often say to me, that's a weird combination, but I think God means us to be whole, and that's what we ought to be doing.
Absolutely, yes.
So I resonate very strongly with the idea of presence and being with people in a way in which you cannot fix some things. They're going to die. They've gotten really bad news in the hospital. I spent my first year of clinical training in the state mental hospital in outside Louisville, and in the 70s. So I'm getting up there. So it was a very different kind of experience. Some of those folks had been in the hospital 40 years. And I was part of that wave that came through mental health about getting people out into the community. And I got lots of stories about that kind of stuff. So I resonate very strongly with the idea of presence.
Fantastic.
Yeah. As a professor, I look at these two lists and think that we don't teach either of those lists particularly well in a master's program. They don't get either all that detail on the job or all that detail about the calling.
Yeah.
And I think that oftentimes we get lost in the job and lose the calling as a result. But I more resonate now to the calling because I don't have to worry about the money, and I think that's a big part of it. Being able to manage both, to get your head around doing the job that is being asked of you in the early part of your career, but also hang on to the calling, I think is a challenge.
It is.
But I love you bringing it forward because as a supervisor, this kind of inspires me to see how I can keep both happening. Yeah.
Mhm. Fantastic. It's nice to be with people that have a similar thought process and not forgotten that it's a calling and not gotten lost in the job. Okay, so before I get into some specifics of transformational inquiry, I feel compelled to just not be throwing another model at people, and just to talk a little bit about how I understand models and some of the lack of nuance that we have in our field as we talk about models. And as somebody who's training brand new therapists, I know that we impart a lot of confusion with how we talk about models, a lot of mixed messages, and a lot of times I think we facilitate both in new therapists and even therapists who are quite experienced, um, some imposter syndrome around the use of models, what they are, what they're not. So I think that some of the common ways we talk about models of therapy are they're like a medicine, that there's a dosage of narrative therapy that we can all prescribe, which is silliness, obviously. We could all read the same books on narrative. We could all attend the same workshops, but we're never going to be doing the same narrative therapy, right? We also talk about models like their tools. What model are you using? I'm using EFT or I'm using structural therapy. There's the match the model to the client, which again is more medical model thinking. So depending on what client shows up, I'll match the model. Um, Back to tools, models aren't physical things. You can't touch them. We don't use them the same way. It's not like a screwdriver or a hammer. And even maps, which is a step in the right direction, but maps are typically around fixed territories and about getting from A to B. And we perpetuate, I hear colleagues all the time talk about what model are you using? What are you applying? You should date your model, whatever that means, or you should not marry your model, or you should learn one model and then branch out to others, or you should borrow from a lot of models. There's not a whole lot of consensus, and again, not a lot of nuance in how we talk about models. I think it's much more apropos to talk about models in terms of they are ideas about context. They are ideas that help us orient to therapy. And so different models are going to focus on different things. So to compare models is almost like comparing apples to oranges. If you have an approach that's focused on emotions, and then we have an approach that's focused on behavior, right? They're strange bedfellows. So models are, rather than tools or maps, they are ideas that inform our participation. I never ask my supervisees, what model are you using? I opt for the more clumsy, what is informing your participation? What ideas? And specifically, the ideas that I think are important that models answer the question, what are ideas about health and pathology? Family therapy from its roots has always been one step removed from pathology, right? The idea that symptoms can be looked at through the transactions of a family, the individual pathology fell away immediately. And then the postmodernists sort of took it to another level and really started looking at ways that we perpetuate inadvertently therapist expertise and clienthood, if you will. And so they teased apart even more and more, chipped away at all the different ways that the context might speak to a context of pathology. So first and foremost, your model says something about health and pathology. Structural family therapy, the pathology is in the family structure. It's dysfunctional. There's enmeshed relationships. There's disengaged relationships. Okay, so you hear the pathology, you hear the deficit language. EFT talks about anxious attachment and avoidant attachment styles. As much as EFT talks about being a non-pathological perspective, it's still part of the language of the model is dysfunctional interactions. And again, those are attachment styles. So what our models do, right, is they create the problem and then prescribe the solution. An EFT therapist is going to focus on emotions and maybe having attachments being more secure through enactments in a session. A structural therapist is going to do something that they believe realigns the hierarchy, strengthens subsystems. So it orients us to ideas about health and pathology. It also orients us to what is the theory of change? What has to change? And again, the model dictates first we decide what's pathological, and then we provide how to change it. In CBT, it's thought that dysfunctional thought patterns and dysfunctional behaviors are in a reciprocal relationship, and they are pathological, and the task of the therapist is to help people replace those dysfunctional thoughts and behaviors with more functional ones. You get the idea. The third context marker, or how we're informed by a model, typically is what is our role? And it's very connected to the first two. So a therapist can be a coach, therapist can be a mediator. A big one that I don't really have a good name for is the therapist that provides insight. If we talk about patterns, if we talk about your history and your past, some sort of pattern will emerge, and that insight will be a useful thing. So again, we need to think about models in terms of they inform our participation in this context. It's more like a religious ceremony. You don't use a religious ceremony, you participate in it. And there are certain practices in certain religious ceremonies that if you're familiar with it, you grow to expect. There are certain behaviors, rituals. Same thing going to a football game. We have a shared understanding of the context of attending a football game. There's going to be cheering, there's going to be sitting, there's going to be standing. There's going to be refreshments, right? We're familiar with the context of football game. When we go to the theater, it's a context for interaction, and they help us to organize our participation. Questions, thoughts? Okay, so I'm proposing a different relationship to models. Again, we don't use them as much as we are informed by them. I don't look to see when I'm training a therapist that they're performing a model. In fact, I tell them that the last thing that they should be thinking about while they're in the therapist chair is their model. And I know I have many colleagues who give a very different message. I had a supervisee recently say, first I asked a circular question, then I asked a scaling question, and then I was looking to ask a relational question. They're in their head. Anything that robs you of your presence, we'll see, is something that we want to be paying attention to. And too much thought about your model. I oftentimes tell my students, you know, when you're learning to swim and you're finally in the deep end of the pool, you don't need a book about swimming at that point. Or you don't need a book on dancing while you're dancing. Models are really valuable after therapy in supervision to give a shared language about how you're talking and thinking about a case. Models can be really helpful before a session in helping you to organize your participation and help you to understand what's going on. It can be really valuable to watch people do therapy from different perspectives and understand their understandings about the context. So there's a place for them, but I just think the lack of nuance in how we speak about them really does not only ourselves, but the next generation of therapists a disservice. Okay, so that being said, some of the foundations to the present-centered approach that I'm talking about, these are, I'm guessing, familiar names to most folks, and they're just a smattering of people that have influenced my thinking. These folks really brought to me the idea that context is important, and it's so central to the work we do as systemic therapists. We can make sense of all behavior in context. And as soon as we can make sense of it, we can understand it better. And understanding is part of connection, as we'll see. So transformational inquiry borrows from systemic thinking, but it also borrows from spiritual approaches. I've been greatly influenced by Alan Watts's work. Eckhart Tolle, I'm sure many of you know. A lesser known figure is Anthony DeMello. Anybody know Anthony DeMello? He was a Catholic Jesuit priest from India who was also a therapist. And so he was right at the intersection of spirituality and therapy. I would encourage you to get his book, Awareness, it's called. It's fantastic. Or listen to his lectures.
Yeah, I also agree. I love Anthony DeMello. I'm absolutely highly influenced by particularly his lectures. I love to listen to. And back in the day, of course, it was cassette tapes that I would listen
Yes.
to.
Yep. So I'm sort of standing at the intersection between systemic ideas and spiritual ideas, most notably how to be more present with people. Eckhart Tolle, The Power of Now, is speaking to that. So if I were to sum up transformational inquiry in a simple formula, and my brain only thinks in simple terms, I don't know how people can keep track of the stages or the complexities of some approaches to therapy. I think simplicity makes sense in this context. It's a two-part formula. One of them is something that we need to be actively engaged in moment to moment. Connect, and then connect more. And the second part of the formula is what we are actively not engaging in. While we're connecting on multitude of levels, we are simultaneously resisting the urge to diagnose, see, and subsequently fix or change pathology. That's it. That's the formula. It's simple. Those of you that have attempted to meditate, you know it's simple to watch your breath, but you also know how difficult it can be. Simple, but not easy. I am laser focused when I'm sitting with clients in connecting to them and squeezing out all of the noise is the challenge. All of the noise that has to do with what I see my role and the value that I bring. I've redefined value as not knowledge necessarily. There's a place for psychoed in therapy, but in a way, I kind of think of it like clients are drowning in the ocean and we're safely on a shore, and we are reading to them anger management strategies or communication strategies. When we're talking about presence in the way I'm going to be talking about it, you have to throw away the book and jump in the ocean with people. And that takes guts. So the formula is simple. Connect while simultaneously resisting the urge to see, diagnose, and change or fix pathology. Simple, but not easy. Let me talk about connection first, the first part, the part that requires our active engagement. This is not a passive therapy. These are all familiar to you all. Validating clients, empathizing, understanding with a capital U, normalizing where it's appropriate, shedding the imperative to want to change or fix people, offering multiple perspectives. This is not a finite list, but I think this is a good start. These are the activities that bring value to people. We tend to think that, clients want answers from us, and oftentimes they come to therapy with, should I get divorced? Should I move to Alaska? Should we have another child? But I think a big part of the process of therapy is having clients ask better questions. And when they recognize, I like to tell my students that imagine that your clients are coming to therapy starving, wandering the desert, hungry, dying of thirst. And the only thing on their mind is a few crumbs and maybe a few drops of water. Imagine that's how clients show up in our offices. They just want a few crumbs and a few drops. When we start to connect in a very deep way, we are offering clients gallons of fresh water and a banquet of healthy food that they didn't know to imagine. And so they learn to see the process as offering more than a quick fix. And there are exceptions to that, and we can certainly talk about it. But the majority of time that we say clients want answers, we're putting that on us more so than our clients. Clients occasionally do, but more often than not, we're feeling the imperative more than them directly asking for it. So none of these are strange, I'm sure, to you folks, and they're part of the relationship building process. The difference with transformational inquiry is it's not a preliminary part of the process to build a relationship to gain clients' trust so that when we hit them over the head with change, they'll be more susceptible to it. It's about a therapy where this permeates the entirety of the process. Let me stop for a minute. Thoughts, questions?
Hey, Paul. I'm sorry I keep
No, please.
interjecting here, but I'm so kind of on board what you're saying, and I appreciate it. One of the books that I required when I was teaching pastoral care, it had a lot to do with practicing listening and the notion that you were talking about, how to kind of stop the noise. You know, I liked your language around the noise. It's a lady named Anne LeClaire, and she wrote a book called Listening Below the Noise, the transformative power of silence. You know,
Fantastic.
it's a meditation, the practice of silence, and that's part of what I think. You know, it's you before you can be present, you know, you have to kind of stop the distraction and stop and reduce, at least
I think he
reduce the
froze.
noise and reduce who me and reduce the noise. So I appreciate again you bringing up that idea of how to kind of how do we reduce the noise so that we can be available and present.
Yep. Yeah. And it's a simple idea, but as you're suggesting as well, it's not always easy because there is a lot of noise. And we'll see where the noise comes from. Did we lose some folks, Annalyn?
No, I'm not sure if I froze but I think we're back. I may have frozen there for a little bit. So
Okay.
but I think we're all back now. Yeah. As I look at this list, Paul, I'm connecting it back to a lot of the things on the list for the job.
Yep, absolutely. So one of the things I tell my internship one learners is get to know the little pathologist that lives inside your head. And that little pathologist is fed by culture, by media, by oftentimes our courses that we take, our education, our own sense of the role of a therapist and what we do. But that little voice is automatic for most of us until we start to pay attention to it. And there's obviously, there's the screaming pathology of DSM diagnosis. And then there's the less screaming pathology of my clients struggling with anger, low self-esteem, communication problem, intimacy issues. But there's a lot
Poor coping skills,
more coping
manipulative.
skills. Right.
Yeah.
Now, obviously, we meet clients where they're at, right? We speak the language of pathology to people, but we're talking about not being constrained by it in our own conceptualization. One of the many inspiring examples from Milton Erickson's work. I'll just share one that always inspired me. The day that he was at a psychiatric facility, inpatient unit for hardcore psychological disordered people, and he was to meet a new patient that day, and there was the long list of hallucinating, multiple personalities, schizophrenic, fill in the blank. But the one notable feature about this patient was that he went around acting as if he was Jesus Christ. And so upon meeting him, Erickson stuck his hand out and said, "Hi, my name is Dr. Erickson. I understand you have experience as a carpenter." and he put him to work in the wood shop at the hospital. And as the story goes, the guy was fantastic at woodworking, and he left the facility. There are so many inspiring stories of Erickson's, how he was able to embrace the worldview of people, and sometimes that included the pathological discourses around them. But he was also able to transcend them and not limit him in how he interacted with clients. So I encourage folks to notice when you're sitting in the chair, we tend to ask questions from the perspective of trying to figure out what's going on. And what's going on is code for what's wrong, what's dysfunctional, what needs to change. The little voice that wants to categorize people and their experiences. And a really, really popular habit of the inner pathologist is once it identifies a pathology, it loves to go into the past to look for its causes, that linear causality of what caused this pathology. That is the bread and butter of the inner pathologist. Name the pathology and look for its causes. Somehow identifying the causes, it's thought is going to release people from it. Having that insight that the reason you keep choosing poorly in relationships is because of your parents' divorce, or you were dropped on your head when you were a kid, or some other story. It's one thing when clients bring us these narratives and we connect to them and embrace them and validate them, but we don't necessarily have to be constrained by them. The inner pathologist is, again, the biggest obstacle to being present. So yeah, what has fed it? Our professional conditioning, again, our education goes a long way toward perpetuating the fact that we have to be fluent in diagnosis and assessment. Again, very valuable to the job of being a therapist. In some ways, very undermining to the calling of being a therapist. The idea that clients come with expectations that we're going to tell them what to do, or we're going to tell them what's wrong with them. Again, that tends to fall away when people have the light of validation, empathy, understanding, when we're able to hold the space for people, when people can leave a session and feel like I'm not alone or I'm not crazy. How many of you have literally seen the weight lift from your client's shoulders when they just feel like they're not crazy anymore, like somebody gets them? Can anybody speak to the pressures or their own inner pathologist if you've recognized it in yourself?
This week in class, where we have a discussion that they have to talk about the difference between the therapist that diagnoses and the therapist that thinks systemically, and that every model diagnoses to an extent.
Yes, right. I mean, we're for diagnosing attempted solutions. I guess I would kind of argue that solution-focused therapy, when it's practiced the way, I think it's supposed to be, really goes a long way toward, not diagnosing and really just avoiding the issue. Do you see that similarly or different, Annalyn?
I think that, yes, as you said, if it's done with this mindset, too often what happens is that new therapists try to do solution focused, but they end up problem focused and thinking that they're supposed to make the client have an insight about
A solution.
doing more.
Yeah.
Right. Or that they think that they do what I would call solution forced therapy. So yeah, I always say solution focused is a deceptively difficult model. It's very difficult to do it very well. You have to take on a lot of assumptions. I think narrative also has some potential to be non-pathologizing and all of that.
Absolutely. But where it sneaks in is, this is the bad story and we're going to replace it with a good story.
Yeah, I
you know,
agree.
sort of
I agree.
misunderstanding.
And part of that, I think, is that most of our MFT models were put together in the 60s and the 70s before we had the postmodern critique of that, multiple perspectives. And I lean more in as you talk, I'm leaning more into collaborative language, or what else, reflecting team,
Mhm.
right? Those kinds of ideas,
Tom
which is,
Anderson was ever aware of de-emphasizing pathology. Just turning the
yes,
cameras on the reflecting team was such a leap
yes,
toward that,
yes, yes, yes.
and certainly
Tommy,
helped.
you taught forever. What are some of your thoughts on this?
Well, I think it's, I think students or beginning practitioners feel encumbered by their uh, inability to know everything and know how to go walk into a room and what to do first, second, third. And I
Mhm.
think that's where they get the idea that they have to do something. Could be right or could be wrong or whatever, but they're forced to be able to identify a model or a question, the questions that a model will hopefully bring forth or not, type of thing. But I think that confidence that you can walk into a room and be there, whether it's silence or uh, just nodding or those kinds of pieces that says, I'm here with you. I'm here, to be with you for this hour type of thing, rather than saying, okay, I want to know this and this and this and this. Well, that automatically sets the stage for clients to possibly pathologize. And the
Well,
thing,
I mean, and they're required to do that, to do a biopsychosocial or an intake, and that sets the stage for all of that. Yeah.
and that's
Absolutely.
how we get paid by insurance companies. And
Right,
you have to pathologize or you don't have a client, right?
right. Yeah, it's teasing apart the layers of this that can be challenging for sure.
But
Yeah.
I think the good part of that is for students and early practitioners, well, all of us. I mean, this is very, very informative, Paul. Wonderful. But I think it's important for us to see the value in ourselves of what we are not forced to do, but who we are in the process of being.
Yeah. Well, and how about the contradiction that, the common factors research all pointed to about 10% of change is due to model factors and 35% is due to the client therapist relationship. And yet we relegate the client therapist relationship to sort of a stage in the process. And like you say, Tommy, we're focused so much on knowing a model.
Mhm.
Is there any
Right.
wonder
and
that
and pathologizing accurately, and having and then writing a treatment plan where we have to measure that
Mhm.
pathology, the change in that pathology.
yeah.
Yeah.
An interesting piece, just a very quick sideline. I had a student I was working with, supervising. He was a doctoral student, and he was doing an internship at a psychiatric hospital. And the client would not talk, but she would lay on the floor and look up to the ceiling. And in the supervision, he says, "Now, what do I do?" I said, "Get down on the floor
Down on the floor.
and find out what she's looking at. What's so intriguing?" And let her describe what's going on.
Great example. Love
It
it.
worked. Mhm.
So, okay, a couple of assumptions of transformational inquiry. Well, the theory of change is really a theory of transformation. It's not change at all. I like to think of change as, I'm the agent of change. The change comes from the therapist, our expertise, our insights, our education. This is really more a theory of transformation. No one's responsible for transformation. It emerges from the process. So it relieves me of the burden of having to change or fix people. I trust that if the connection is solid and deep, that something transformative will happen, that I don't have to engineer, I don't have to steer, I just have to stay laser focused on connecting on ever increasing levels. So
Yeah.
again, it's not preliminary to the work, it is the work. Transformation emerges and people become more of who they are in the process, not unlike an acorn becomes more of an oak tree as it grows, or a caterpillar doesn't change into a butterfly, but it evolves to that part of itself that it already is. It's a different way of understanding change, and it relieves us of the burden of having to be that agent of change so that it can free us up to be present, more present. The second assumption is something I find very helpful. If we're not going to think about pathology and we're going to keep the pathologist at bay, then having a framework like suffering I find to be helpful. Clients, whether they're struggling with addiction or DSM diagnosis or relationship issues or you name it, anxiety, depression, there's suffering in the process. And suffering helps to remind me that this is serious. And it also reminds me that there's nothing pathological about people's responses. And that helps to keep the pathologist at bay. And it reminds me that if I can be part of a process where people's suffering is relieved, that's a good thing. Inviting presence over fixing. So I'm proposing a stance of thinking about the conundrums more like suffering. The other assumption I want to touch base on is sort of the role of the therapist. And again, to me, this is sort of the bread and butter of how to evaluate a model. What does it say about change, the role of the therapist, and what are the ideas about health and pathology? The role of the therapist is to be radically present. I thought about calling it super joining, but that just didn't sound very good. I'm distinguishing relationship building that we tend to relegate to just a part of the process to this stance of being radically present. I sometimes tell training therapists, it's like people come to therapy and it's representative of them being in one of those old-fashioned phone booths. And that represents them being trapped by their problem. And most approaches to therapy talk about building a relationship in such a way that you get closer and closer to the person inside their phone booth that represents their problem. And when you get close enough, because you built a relationship and you built trust, the client eventually opens the door to the phone booth. And then according to our model, whatever it says about change, we somehow reach in and bring the client out of the phone booth. In transformational inquiry, I suggest that we start that process exactly the same way. We build a relationship and we build trust, but we keep doing it. And we get closer and closer. And then when they open the door, we don't pull them out, but we continue to build the relationship, continue to be radically present with them on a lot of different levels. And so now we're standing in the phone booth. And I suspect everybody here on this call has been in a phone booth with at least another person. What usually happens? There's a tendency to want to get out. But now if a client leaves, it's very different. I'm not dragging them out. Solutions are emerging. Problems are dissolving. Possibilities come into existence that didn't exist prior to. But now they're leaving on their own and they're not dependent on the process. And I don't have to pat myself on the back about how I was so valuable as a therapist. You definitely have to check your ego. People either leave the phone booth, the metaphorical phone booth, or they stay in the phone booth, but it's different. They're no longer trapped. They're no longer tyrannized by their problem. That's a big success in therapy. Nothing changes, but everything's different. Right? The parent who is overwhelmed and feels like they're failing as a parent because their kids fight all the time. If a simple reframe like, well, sibling rivalry is part of the development of healthy kids, right? Nothing can change, but everything can be different for that parent. If they recognize that what they thought was pathological fighting can be seen as part of the process of negotiating relationships later in life. I'm just giving you a quick example of how nothing necessarily has to change, but a person can be greatly relieved. It takes guts to be radically present with people. It is a leap into the unknown. It is leaving the safety of the shore to jump in to the desperation, the unhappiness, the hopelessness, the addiction, whatever that our clients present with. We have to let go of being an expert and trust that presence will lead to something transformative, and I don't have to control it. Okay, so none of these are going to seem like new information. That sounds like abandonment issues, right? That way of talking to clients, which can be commonplace, instead of what's it like for you when you don't know if someone is going to stay in your life. We go from categorizing to staying curious. I neglected to say on the slide of connection that the lubrication to keep the flow of connection happening, and the one thing I suggest therapists practice is curiosity on ever increasing levels.
Yeah.
You have social anxiety. What's it like? What happens inside of you when you enter a room full of people? That's the difference. Your anger is a defense mechanism against feeling vulnerable. What is your anger asking of you right now? Again, none of these questions are probably foreign to you, but what might be different is the consistency with which we focus on that. And while we simultaneously resist that urge to name and fix what we see as dysfunctional. Thoughts, questions about anything we're talking about?
I agree that you know I read all the same books and I know where you're pulling all of this stuff from. I think what is speaking to me about is you know, it's like the concept of not knowing. I think a lot of us think of, oh, well, I'll be not knowing for a while until I know, as opposed to let me stay in that not knowing place permanently. I'm permanently in a not knowing place. And so that I'm always curious, I'm always wondering. And I'm not doing that because I have a particular outcome in mind. I have no idea what the outcome is going to be. That's their job. My job is just to keep being curious, keep wondering, keep exploring.
Yeah. And it's not like we're not, solutions don't get talked about, right? So change is talked about all the time in the context of curiosity, but it's one thing to talk about change, and the other is to be constrained by a definition of something that's pathological and needs to change, right? So I could say to parents struggling with their kids' behavior, what's it like when you take a hard line with her? I'm staying curious, but it's also a seated intervention, right? Oftentimes parents will come back and
It's the
say,
Milan team. Every question is a potential
it's
intervention.
right.
Yes.
So this is not a passive, don't give input. You know, talking about the pros and cons of moving to Alaska is fair game, right? There's nothing wrong with that. So it's not like we're not talking about change. We're just not biased or invested toward it. And we're at least as interested in stability as we are in change.
Or not
Yeah.
pushing a client into change.
Yes.
Well, if you change this, then
Pose, but don't impose.
yeah. Mm-hmm.
I like that. Pose, but not impose. I like that. I like that.
Mhm.
Yeah. Yeah. I notice a lot of new my internship one people are they get curious and they pose those questions like you're saying, and then they want to take it the next step and give a homework assignment. Well, now therefore go do this. And I'm like, no, no, no. People are smart enough to figure out what the next step is.
Right,
All you're doing is let's put this all on the table and see what we have, and then they're smart enough to figure out what to do next.
right. You don't have to prescribe the date night, right?
One of your least favorite homework assignments that you hear people do. Yes.
So I've been writing about a variety of ways to stay present in the process of therapy, and we just have time to kind of look at a few of them. Um, the first one, those of you familiar with Eckhart Tolle's work, he draws the distinction between your life and your life situation. And it's a beautiful distinction, I think, for therapy. Um, how do we turn the dial from seeing ourselves as consultants to people's life stories? So my life story is I live in Plantation, Florida. I've got 3 kids away at school. I like to go to the gym. My mother's 90 years old and lives in New York. This is all my life situation, among many other things, my history, etc. My life is what's happening right here in this moment with you folks. And in therapy, it's when I'm breathing the same air or I'm doing telehealth session. That is my life in that moment. We too often see ourselves in the role of consulting about people's life situation. So something we talk about here in therapy is going to be useful to your life situation. I want to turn that and invert that a bit. The life situation fosters the connection that we have in the present. Let me say that again. The life story, the life situation, the content that people bring in to talk about is important, but it's secondary toward utilizing it to further the therapeutic connection here in the present moment. That's a different way of thinking about this work. So I sometimes tell trainees, imagine that I pull out a shirt that I just went into my closet, connect with me. And they usually start with, oh, that's a nice shirt. Oh, what a great shirt. Until I tell them, I wait for somebody to ask me, why did you choose that shirt? Well, this shirt has a lot of meaning for me. Okay, then somebody's curious enough to say, well, tell us more. Well, I proposed to my wife in this shirt, and it was a really great day, and I have so many good memories. And so I get a lot of cheerleading after that. And then I said, but there's more to the story. So then somebody says, well, what other meanings does it have? Well, I was also wearing this shirt when I got into a car accident and I broke my hand. So I'm trying to jar them out of seeing the content as what they're consulting about, but rather use the content to further the therapeutic connection. I suffered abuse as a child, so from a problem-solving perspective, who, what, when, where, what were the dynamics, how does this impact your current relationships? We're trying to figure something out, is the therapist's intention. We're asking questions to figure out what's going on. We're asking questions to gather information. I've replaced that intention with a very different intention. My intention in asking questions is now solely to elicit more information to connect to. Connection being that list of things, that list of categories of things. That helps me to clear the decks of a lot of the noise. Every utterance, I sometimes tell learners, imagine your clients have come to therapy and they've got 100 pounds of bricks, 100 bricks. Every utterance is a potential for you to validate, empathize, normalize, etc. And that removes a brick. Every utterance is another opportunity to remove a brick. And if you do this over time, you're constantly removing bricks and the suffering is decreased. So we're contrasting that with what's it like for you to share this story with me right now? I'm struck by the strength it took to survive those experiences. Can you speak more to how do you think these experiences have changed who you've become? Again, curiosities that I'm sure that you've all had. It's just that's all I'm doing is asking questions like that with that sole intention of deepening the connection. Did somebody have their hand up? Okay. With couples, who said what first? What triggered the escalation, for example? How did that make you feel is a common question. Instead of what's it like for you when she describes being triggered when you bring up her mom? Can you speak to that feeling of being triggered? I don't take any words for granted. Everything is fair game to say, can you speak more to? Can you say more about? I also want to talk about the practice of conversational tethering. We tend to enter into therapeutic conversations with sort of a free-flowing riffing style, which is fine, but it can be really helpful to stay close to the exact language and let your client inform your participation by what they just said. So you're tethered to them in a way that if you are thinking about your model, or if you're making notes during the session, or you're distracted by something, you're going to miss the invitation that they're giving you to invite them into a deeper conversation. It's not an invitation for more content. It's an invitation for a more depth of experience of who it is to be them with this particular problem. So when a client says it's like there's a wall between us, so there's a distance in your relationship, that's a fine summary. But when you're tethering, you're more specific than that. You're hearing the metaphor of a wall. It's low-hanging fruit to be aligned with the language. Tell me about this wall. What's it like having this wall between you two? I know a lot of people develop walls to protect them. To what degree is this wall protecting you? Infusing the conversation with curiosity. I just need to get my ducks in a row. Again. So you want to feel more organized. Good? Better? They're using a metaphor. Talk about the ducks. How many ducks are there? Which are the important ones? Which ones can you let wander off? Staying very close to their language and allowing your next communication to them to be informed by what they just told you. I do this, I don't know, 70, 80% of the time. And then I'm free to ask questions from my perspective. I quote Dr. Schooley at least once a week when she says, don't drive the bus. I think this is what you're saying. You're saying when you allow clients to inform your participation, they're driving the bus. I can take the pressure off me to figure out what the next thing. I'm not going down the list of things to ask clients. I don't have to be creative enough to figure out where this is going. They're telling me where it's going if I'm tethered to the conversation. And I can only be tethered if I can be present.
I can look out the windows and get curious about this route that we're taking and the building that we just passed and what's the road like. And yeah, so I'm free to look out the windows and wonder about this journey rather than taking control. And right. Yep.
When we're not tethered, it's like 70 miles an hour on the highway, which is fine for everyday conversation. But like you're suggesting, therapy is more of a 5 mile an hour walk. You want to learn a lot about the significant things instead of a little about a lot of insignificant things.
Mm.
So tethering helps you to do that. It brings you into the present. You're listening for phrases to use back with clients. You're listening to their language. You're using the silence that folks were talking about earlier and the pauses. You hit a wall. Ouch. Pause. What's it like with that moment of impact? Right? You get the idea. Deepening invitations. Very similar idea. Listening for words and phrases that clients are using that are inviting us to invite them to a deeper understanding of who they are, what they're going through. Sometimes it's just repeating back the language and letting it hang. Again, not taking for granted any words. Frustration, anxiety, worry. Can you speak to that worry? What's it like when you notice that that worry first shows up? Again, I'm sure all questions that you use all the time, we're using them a little bit more specifically. We're using them for the sole purpose of connecting. Connecting deeply sets the stage for something transformative to happen. With couples, partners often use charged language when describing dynamics. I'm tired of being the responsible one. What's it like always having to be the responsible one?
Mhm.
Can you speak to having to always be the responsible one? With families, same thing. Family members talking about their experiences. Father might comment, that's just how we've always handled things. I'm curious how you've always handled things. Can you speak to that a bit more? It's as simple as, can you say more about? Can you speak to that? What was going on for you that moment that you saw her laptop open and you found the email? Can you speak to that moment? That's asking clients to dig deeper. They've invited you to invite them to dig deeper. As their partner or family members are witnessing that deepening, really, really interesting things are happening. And I can't overemphasize that enough. The witnessing process, when you have couples and families together, we too often split people up for the wrong reasons. And now that witnessing process goes out the window. When you are connecting deeply with one partner in a couple, their partner is taking in a lot of new information. And we're only looking for softening, right? If they can soften to each other, that's the difference that makes a difference in couples work. All right, well, that's what I got. What thoughts or questions about what we're talking about comes up for you?
That's a beautiful way of moving it out of the language that we've taught so well to use and to connect with. But it's a connection that is uh, more negative in many ways and pathologizing, even if we don't realize that we're doing it. So for a client, it's kind of like they can get on this hamster wheel and go forever with that. And so, what at the end of the session, what did they get out of that? What did they learn about themselves? What would they like to do, over the next week or so? When do you even want to come back in? Type of thing, the kind of thing. So, if they really are able to regenerate ideas about these meanings,
Yeah.
and they don't have to worry about that.
Yeah, I think people are attuned to when we're therapizing them. Sometimes people use that language
Mhm.
versus stepping back from their content and just witnessing it. It's interesting how we put the word just oftentimes in front of I just listened or they just vented the whole session. That venting can be the difference between life and death in clients.
Mhm.
Yes, Beth, I see your hand. I think you're on.
You'll need to there you go.
Unmute. So I just feel so happy that I had a meeting with Dr. Schooley today, and I got to be here for this meeting because this just completely resonates with my soul and who I want to be as a therapist. And I can say that the therapist I had, and I've had many, who helped me the most was the one who practiced just this way. So yes, it totally worked on me.
Yeah.
Cool.
I know how to do all this stuff, Paul. I trained out of the same program you did. I think that I'm wondering if I get hijacked by that inner pathologist, particularly around the issue of I should be doing something here. I should be making something happen. I and as you said, I think clients also kind of expect that. You know, I'm thinking of one of the clients that I'm working with, and while I try to do this very work with them, I know that one of them is checked out. The husband's I don't think he is listening and getting a whole lot out of it. And so you know, I start worrying about that. So but I also think that I probably don't do it. I don't know enough clinical work these days. I think I would get better at this if I was doing it a whole lot more. I almost envy Beth and Meredith and those who are, you know, doing 20, 25 hours of clinical work. It gives you a chance to stay in this mode a lot better, I
Right.
think.
I think you're speaking to one of the biggest challenges, and that is letting go of the idea of what value do I bring to the process.
Mm.
And when I think about, Aunt Grace, the people who were trying to make her feel better were trying to bring value. Um, my teacher who was trying to bring value to the depressed client kind of gave up, was frustrated, and brought value in a very unusual sort of way that wasn't about the traditional ways that we think about value, making something happen. When I'm doing live supervision and I'm watching a session, I can sometimes see that the therapist is working really hard to get both parties to try and see each other's perspective instead of just working really hard for you to see their perspectives and connect to them, and trusting that the value will emerge. People do
Mm.
not leave connecting conversations like we're talking about and ask mundane questions. Rarely. They feel the value of presence. Again, nothing is off limits, right? So with your client who you're wondering if he's getting anything out of it, you know, at some point, is there an opening to turn to the partner and say, what do you think your husband's hearing? What do you think he's getting out of this? And vice versa. So it's not for the faint of heart to plunge into connection, because we have to connect to a lot of, challenging, toxic, heart-wrenching things in therapy. It's not for the faint of heart. And so I guess I try to sometimes impress that if you're giving up the work of making something happen, trust that the work of connecting is a tall task. It's not easy to connect in the face of screaming pathology. Things that, out of context, you would say, what the heck is wrong with this person? Maybe they should go see somebody. And then you realize they're seeing you. Oh, yeah, that's right. That's challenging.
Yeah.
Yeah. So you remind so what maybe you quote me, I don't know, but I am known to say 3 ways to goof up as a therapist is wrong people, wrong problem, and getting invested in an outcome. And I used to say getting invested in a specific outcome, and I was able to drop the specific to say you goof up by getting invested in an outcome, any outcome.
Mhm.
And boy, it makes a great mug, but but really truly not being invested in an outcome. That takes a level of confidence in the process that, for me at least, is waxing and waning, because I don't do it enough. I think I was better at it when I was doing 20, 25 hours a week.
It's a big part of the process, right? Letting go.
Yeah.
Right.
Yeah.
Easier said than done when you like your clients and you're cheering for them. Um, Absolutely. Yes, Beth.
Unmute, please.
Thank you. So I read that book called Maybe You Should See Someone. And I was in my master's degree program. It was a couple of years, probably a year and a half, 2 years ago. And do you think that the author, and I forget her name, was she practicing this way of being, do you think?
I'm familiar with the title, but I haven't read the book.
Yes. Okay. Shoot.
But it's been
I
recommended to me by several people, non-therapists.
Yes, it's so her client in the book, or several, but he was very high up in the motion picture industry, and he was very arrogant in the way he, came in, and he would bring lunch with him and eat in front of her and take phone calls. And she talked about the process of how annoying it was, but then she just learned to be with him the way he was, and they forged a connection, and it took her a long time. And then through that beautiful connection, he grew and worked on the things he wanted to work on. So it just it's sort of wrapping it up in a neat little package to have read this book. And she had a lot of description of the particular case and how it worked. So
It
it,
sounds very similar, right? When she gave
yeah,
up the therapeutic agenda,
yes,
all of a sudden
exactly.
interesting things happen.
Yeah. Yeah.
Yes.
One of
I
my,
really recommend that book. It's just so great.
yeah, I think the universe is recommending it because you're like the third person who said that.
Yes.
Look,
And
one of my,
somebody even used those words. Maybe you should talk to someone, and it made me
yeah,
think about the book.
one of my first cases as an intern was in elementary school up in Ozone Park, Queens, in New York, and this kid who was wandering the halls, that the teachers and the faculty, all the administration, they just let this kid wander the halls. And I tried to engage with him, and he spit on me. He didn't want anything to do with it. But I didn't have a language as I do now, but I was inspired even back then by reading some of Milton Erickson's crazy stories of engaging people. And I had the experience early on of walking the halls behind him, in front of him, over time, till the one day he finally said, "Can we talk in your office?" And I'm skipping a lot of in the middle, but it's that same thing of just sort of abandoning where anything this is going and just trusting that something interesting is going to happen if we focus on what's possible and connecting to people.
Yeah. Ariel, do you have any thoughts? I want to make sure you don't feel silenced.
No, you're good. Well, it's been a long day, so I feel brain fried. So I don't know how much I can say that's super articulate. I think one of the things that came up for me was I think a lot of Burnett talks about the art and the therapy of science. And so when you talked about the job and the calling, right, I was thinking of that some, but I do like that language better. And I think of how much time I spend convincing the baby therapist. I think it could probably, it's internship 1 for my people practicum, to kind of just, right, we there's no other good word, just go in the room and be with them, don't worry about all this stuff. And so I think that stuff really does align for me. I think I would have to spend more time with some of the stuff you said about the models for me to really like wrap my mind around some of that. But I do love this idea of presence and how far that goes, and this idea of connection and attunement. I think that really is the bulk of the work.
Mm.
Yeah.
Yeah. Yeah.
Well, we certainly have all had those days where our brains are fried. I know everybody on the call can relate to that.
Well, when are you going to write your book? I mean,
It's mostly written, right, Paul?
Yeah, I'm just putting the finishing touches. Hopefully it'll be out in some form, digital or otherwise, in a month or two.
mhm. Great. I think it's so important to get it out and recommend it to therapists across the board, new or senior, therapists. It's a good reflection for me about me. What am I doing? What would I want to do different? I used to be so adverse to just talking about a problem because I never saw anything as a problem, that type of thing.
Yeah.
So that's one of the things where I started is focusing on what is this conversation about a problem? If it's not a problem, then we're making a problem. So in some of my teaching, and supervising is that, if you have to talk about a problem, whose problem is it?
Right. And how is it a problem for them? Classic MRI stuff. Sorry. But yeah. Yeah. I resonate to so much of this, and now my dilemma that you've presented to me, Paul, is I agree with your comments about model, but supervision is all about talking about model before and talking about model after. And then so how do I make supervision also include this radical presence? And I guess one thought that occurs to me is I need more watching of videos or listening of audios to talk about how they are being present or ways that they can be present in the session, and make clear about the before and the after is just kind of conceptualizing and then letting that go. It's like working out in the gym and then you go play the game.
Yeah, I think part of it can be, just having a more nuanced conversation about models and not perpetuating, talk like, what model are you using? I think that's a good place to start, is just a little education around some of the misunderstandings and some of the unfortunate ways that we talk about models, and acknowledging the mixed messages that we give as a field, and maybe bringing some more nuance. Yes, Beth.
I struggled with that very dilemma, Dr. Schooley, of how do because I really took to heart in my student internship the statistic that 35% or whatever it is of the result is based on the relationship the therapist has with the client. And so I felt like it was almost like I had to wear two hats. One was to really connect with the client, which I had such a good example from my own therapist, and then try to use the things that I've learned in the program at the same time. But that was kind of my thought. How do I get better at that and still be able to pass the licensing exam and have good results in my registered intern phase? So yeah, it's a hard. I think it could be difficult to balance that.
Yeah, it's not straightforward, this work. There's so much complexity to it, and contradiction at times, and the colliding of epistemologies and agendas. Definitely keeps us on our toes.
And I would like to know, are you going to have an audio version of your book?
That's a good question. I haven't gotten that far yet. Thanks.
I would like to put in a vote for that.
I appreciate it. Thank you.
Meredith, do you have any thoughts? I'm sure you have many thoughts. Any that you'd like to share?
I think my brain is getting fried as well by now. I have experienced the power of presence in my work and how that can change, help, move people. And sometimes my job is just to stay out of the way, get out of their way, and keep my back against the back of the chair. Yes.
It's just as important what we don't do as what we do.
Yes.
Absolutely.
Yeah. Well, Paul, thank you so much for your time tonight. For those listening to this, we will be having, Paul's going to send me the slide deck that I can share. But if you are seeing this on YouTube, be sure to take notes, watch it again and take notes and take a look at all those things. Lots of book suggestions that you've got in there, Paul. I appreciate that for further inspiration from the people who inspired you. And I think at some point we'll have to have more of a consultative supervision where we can practice this and get more direction on that. So
That sounds wonderful. I look forward to it.
I think that's something to do. So thank you, everyone. And I'm going to stop the recording now.
Thank you very much. Thanks.